Every second counts when you're dealing with an opioid overdose, and if it happens to a loved one, the state wants to make sure you are prepared. With that in mind, you may have seen these ads encouraging people to carry and learn how to use naloxone, a drug that can quickly reverse the effects of an overdose. The hope is that enlisting the public's help will drive down the number of opioid-related deaths. According to the latest report by the Massachusetts Department of Public Health, at least 172 people died due to opioid-related overdoses in the first 3 months of 2017. That number could end up rising to more than 300. Fentanyl, a synthetic drug that's much stronger than heroin, is a big part of the problem. It's been found in about 70% of people who died from opioids last year. The state's campaign comes as the city of Cambridge is weighing an idea to give the public greater access to naloxone by placing it in lockboxes around the city. Joining me to discuss all of this are Dr. Monica Burrell, Commissioner of the State Department of Public Health, Jonathan Scott, President and CEO of Victory Programs, and Jared Owen, Communications Coordinator for the Mass Organization for Addiction Recovery. Thank you all for being here.
Thank you for having us.
Dr. Burrell, let me start with you. My impression when I drove by one of your billboards on Route 1A heading south was that you wanted almost everyone to be carrying naloxone. But I read up a bit on the program on the DPH website. You're not quite that ambitious right now, correct?
So first of all, I'm thrilled that you saw the ad because that means it's working and it's out there and people are noticing it. This is really part 2 of our Make the Right Call campaign, if you will. And the goal of this is really for the first time we're reaching out directly to individuals who are at risk for an opioid overdose or whose family member or friends or anyone in their community might be at risk and saying, please be aware of the existence of naloxone, understand how to use it, get educated, and carry it.
So just so I'm clear on this, family and friends is sort of a closed circle. If their community, someone in their community could be at risk, that's almost everyone in Massachusetts, right? I mean, should, I live on the North Shore. There are spots on the North Shore, many spots that have addiction issues. Should someone like me have naloxone in my bag just in case I see someone who needs it?
You know, you reviewed the numbers, and it's really important to think about that as we answer that question. This opioid epidemic is costing us the lives of so many individuals. We haven't seen this kind of a loss of human life since really the beginning of the HIV epidemic in Massachusetts. And with the number of people that we're losing, we really have to have every tool available in our toolbox, and that means that wide aspects of us, our entire communities have to be infiltrated with availability of naloxone, whether or not you know somebody. And you know what? It's really hard for me across Massachusetts to meet people who aren't associated with someone at risk.
Okay, given all that, if someone is watching and wants to go out and get it, how does it work? You can't just go to CVS and get it off the shelf, right?
So we have so the FDA oversees naloxone, which is a prescription medication, just like maybe your blood pressure medicine or your diabetes medicine. So it's not available over the counter. But we have a 3-pronged process in Massachusetts to get naloxone. So number 1, there are bystander training programs that we run through the Department of Public Health or multiple different organizations run across the state. Number 2, first responders, so fire and police, are able to carry naloxone, and over 100 communities across Massachusetts have that capability. And number 3, prescribers and pharmacies carry naloxone. So you can go to your doctor and say, I'd like to be prescribed naloxone, and carry it that way. Or over 700 pharmacies in Massachusetts carry it as a standing order. So there, you don't need a prescription. You can walk in and say, I'd like to have naloxone, and almost all insurance companies cover that.
Let me get Jonathan and Jared in here. You both work very closely with people who are fighting addiction and who are in recovery. Do you think that what Dr. Burrell and the state are doing is the right approach?
I think that naloxone is a miracle drug. I mean, we've had it for a while. It very effectively and specifically reverses an opioid overdose. No side effects. If you were to take naloxone and you're not under the influence of opioid drugs, it has no effect at all. I personally think the more people we can get carrying naloxone, the better. This epidemic has really touched me personally. I'm a man in recovery, which means I haven't used alcohol or any other drugs for almost 4 years. I came up here to Cambridge to start graduate school, and my addiction kind of spiraled out of control.
You were going to MIT, right?
Right. Through, like many people, prescription pills, eventually to heroin that's likely laced with fentanyl. I got involved with the criminal justice system, like many people with addictions do. spent some time in a house of corrections, and then was thankfully released to a DPH-funded treatment facility in East Boston. That's the place that really saved my life. Unfortunately, a lot of my friends and people that I lived with there have not been so fortunate. So 8 people in the 1 year since I left that house have died of opioid overdoses, and I just lost a friend this weekend.
I'm sorry.
So I think that as far as raising awareness and reducing stigma around carrying naloxone, our Department of Public Health is doing a really great job, and they've saved a lot of lives, but there's always more to be done.
Jonathan, let me ask you, one concern I've heard expressed about naloxone's increasing prevalence is that it might create a sort of a perverse incentive to continue using and putting yourself at risk, because the argument being, if you think that people are carrying naloxone, if you think that you can be brought back to life after you overdose, you're going to be more likely to overdose. Is there any merit to that argument from your vantage point?
I don't think there's any merit to it. It would be similar to saying, we shouldn't take CPR classes because there's no risk to coronary arrest, or we shouldn't learn the Heimlich maneuver because maybe your child won't choke in a restaurant. I think that we are dealing with an epidemic of catastrophic proportions. 5 people a day are dying in Massachusetts, and we actually have, as Jarrett said, a miracle way to instantaneously reverse an overdose. And it's really what the Department of Public Health is doing, trying to train people and understand how to use naloxone, I think, is really critical to facing this epidemic.
Let me ask a couple more sort of nitty-gritty detail questions. If someone wants to go get it from their pharmacy, how much does it cost?
So if you're getting it from your pharmacy, it's just like any other medication. So potentially you'll pay a copay, depending on what insurance you have, but it really is covered through most insurances.
Even if you are saying, I want this because I'd like to be capable of being a good Samaritan?
Yes, absolutely.
Right. So I would add to that, many people with substance use disorders are on Mass Health Medicaid insurance,
yes,
and they can actually get naloxone free of charge from the pharmacy.
All right, so that's one crucial thing. Is there any risk, Jonathan, if you are a bystander and you see someone who you think is overdosing, is there any risk to you as the potential aid provider to go and administer the treatment?
Naloxone is one of the simplest things to administer. It's a nasal inhaler. It just takes a second. I think there's always the stress when somebody's in traumatic distress, dying in front of you because of an overdose, what to do, but it's really one of the simplest things to do, and it's incredibly effective. For instance, I have one of my employees, direct care staff, was trained in naloxone, was at South Station, a person going home, a person started overdosing in the bathroom. She saved his life, and when the EMS came, they said, well, you must be an RN, and she said, no, I just work for Victory programs.
Am I right that there's a nasally administered treatment? There's also sort of an EpiPen for naloxone, correct, and some other forms. I don't want to sound callous here because I recognize the gravity of what we're talking about. I assume that some of our viewers, and I think this might apply to me as well, if they saw someone who was overdosing, they might be concerned about, for example, the possibility of contracting a bloodborne disease if they went to administer treatment. They might be concerned that somewhere on that individual's person they were carrying one or more sharps. Are those concerns at all valid?
So remember, the naloxone that individuals are being trained in and receiving is the nasal type.
Okay, so the state's only training on
so
that.
they're giving it inside the nostrils. And the other thing to remember is, again, going back to the numbers, in 2016, we know there were almost 2,000 deaths, tragic. And we also know that in our bystander program, the Family and Friends program, had at least 3,500 saves. So that's 3,500 individuals saved. This is such a critical component. When individuals ask me what they can do, what they can contribute to this opiate epidemic, I tell them, get trained in naloxone.
Right.
It's life-saving.
I would add to being trained in naloxone, the first step is always calling 911 before you administer the naloxone. The organization that I work for did a lot of work advocating for something called the Good Samaritan Law. And what this does is, obviously people that are using drugs often hang out with other people that are using drugs, and there's drugs at the scene of an overdose. And people would be reluctant to call 911 if they thought they were going to be arrested.
Right. And now that is not the case.
The Good Samaritan Law currently covers simple drug possession. So if you call 911, there's drugs at the scene, you won't be arrested. Senator Keenan has a bill this year he's introducing to expand those protections for people on probation and parole so that they won't end up going back to jail for making the right call.
Briefly, the city of Cambridge has talked about a program. They're not quite there yet, but they're looking into the possibility of putting naloxone in lockboxes around the city and thereby making it possible for people to provide the kind of treatment you're talking about. Is that an approach that makes sense to you? And if it is it something that we could see replicated statewide?
Well, we have defibrillators in boxes. I mean, we have looked at other kinds of interventions in the same way. I think one of the dangers of a locked box is you have to call 911 and get a code, and somebody's talking to you while you're administering it if you haven't done the training. And
that's complex.
And it's complex, and it's inherently problematic. So I don't see the need, actually, personally, to have a locked box, but to have strategic naloxone placed, if it's regulatorily possible, I think would be a great way to begin getting it out there.
Jared, I think I saw you wanting to hop in. And then we'll
Sure.
get the last word to you.
I would say this could be a great idea, more naloxone out there. I would say we're in the middle of an epidemic, and we need to be careful of how we allocate our resources, though. We need to make sure that places like treatment providers, right now we're trying to get money for treatment providers to have naloxone on site. They're supposed to, but they're not getting funding. It would be like having a cardiologist's office without a defibrillator.
And these can be really expensive.
Right.
I know that FZO, the EpiPen
Right.
format I was talking about, has spiked in price over the last few years. I want to give you the last word, since you are the woman in charge of all of this.
Well, I just want to remind us, as we're thinking about this opioid epidemic, that one of the real issues here is how we think about substance use disorder. And some of this discussion really highlights that. Substance use disorder, looked at from a public health lens, is a medical disease. So we've used example, just like diabetes, just like heart disease. If there's a treatment that works, we have to use it. So just like you wouldn't say why, we wouldn't be wondering why do you need EpiPens around, or why does a diabetic need insulin.
It's not a sign of a personal failing, it is a medical issue.
It's a medical disease. Naloxone is absolutely critical as we work in prevention, intervention, treatment, and recovery. We really need naloxone to be infiltrated in our communities. We all need to be educated. We all need to work together to fight this epidemic.
All right, Dr. Monica Burrell, Jonathan
Thank
Scott,
you,
Jared
Jared.
Owen, thanks to all of you.